Okay, welcome back everyone. Dr. Lindner. We are continuing with endocrinology, and in this short video, we're going to be talking about the thyroid gland and the parathyroid gland. Now, if you look here, we can see that in the throat here we have this thyroid gland. It looks like a letter H, and right here in the middle is the isthmus. And the thyroid gland does produce T4. It even produces a little bit of T3. T4 is thyroxine. T3 is triiodothyronine. And they are involved in regulating your metabolism. But the thyroid and the parathyroid, so here on the right, we're looking at the throat from the anterior. On the picture on the left, we're looking at it from the posterior, where we see these two lobes on the back, and we see these small little green parathyroid glands. So the parathyroid gland produces parathyroid hormone, and the thyroid gland produces calcitonin. Now, both of these glands, the thyroid and parathyroid, are involved in regulating calcium homeostasis. And regulating calcium in the body is really important because calcium is involved in what we saw before, which was clotting. It is involved in helping the body clot. It's involved in muscle contraction. It's involved in neurotransmitter production. Remember when we talked about the neuromuscular junction, that calcium influx into the synaptic end bulb was responsible for stimulating the acetylcholine to be released in that synaptic cleft to allow muscle contractions to take place, right? It's involved with muscle contraction. We know it's stored in the sarcoplasmic reticulum. We know calcium is involved with bones, right? So calcium, many important functions from muscle contraction to neurology to bone density to clotting. And the body uses the thyroid gland and the parathyroid gland to keep it in check, right? We don't want too much calcium. We don't want too little calcium. So if there are high levels of calcium in the blood, it stimulates the thyroid gland, the parafollicular cells, to release calcitonin. And it will find a way to put calcium from the blood into the bones. Or it'll find a way to tell the digestive tract to stop absorbing more calcium. Or it'll tell the kidneys to excrete some calcium. There's a few ways that the body can lower the amount of calcium that we have in blood and get rid of it. You can pee some of it out, right? That's at the kidneys. The digestive tract doesn't have to absorb anymore, and you could find a way of storing some in the bones. If you have low levels of calcium in the blood, that's going to stimulate the parathyroid gland, specifically the chief cells, to release PTH, parathyroid hormone. And parathyroid hormone is going to find a way to break down bone and release the calcium that's in the bone into the bloodstream. It's going to find a way to turn on calcium absorption from the GI tract using vitamin D. Okay, so there's a few different systems involved here. So we have the bones, we have the digestive tract, and we have the kidneys. Basically, these are the three organs or the organ systems involved in regulating calcium balance. So here, there's hypocalcemia, meaning low blood calcium. So if you have low blood calcium and we want to increase it, well, the bones can be broken down by using osteoclasts. Osteoclasts can break down bone and release that into the bloodstream, making the calcium levels in the blood to go up. What happens at the digestive tract, at the intestines? Well, you can increase calcium absorption by using vitamin D. Vitamin D increases calcium absorption, right? So we can use the bones, the intestines, and the kidneys to increase calcium or to decrease calcium. If we have too much calcium, if we have too much calcium and we want to get rid of some, then instead of breaking down bone, we put calcium in the bone. If we have too much calcium, we don't need to increase the absorption. We'll just turn off vitamin D. We just don't need to absorb anymore. And then we can excrete some through urination through the kidneys, again, using the three systems. Okay, so the parathyroid hormone, which is released by the parathyroid gland, and calcitonin, released by the thyroid gland, work antagonistically to one another. When we come back, we'll talk about the adrenal glands.